This is Dr. Vinaysamuel, Director of Surgical Oncology at CK Birla Hospital in Gurgaon. And I want to talk to you about why HIPEC, that is HIPEC, hyperthermic intraperitoneal chemotherapy, works. Why does it work for patients with advanced abdominal cancer which spread inside the abdominal cavity into what we call the peritoneum? So the reason that HIPEC works, especially when systemic chemotherapy, that means the chemotherapy that is given in the form of injections into the blood or tablet forms, when they don't work as well as they should, why does HIPEC work? And that's a question I want to answer. So what we do in HIPEC is we insert or instill heated chemotherapy inside the abdominal cavity after removing the entire disease present within the abdomen. So this is done for cancers like ovarian cancer, colorectal cancer, stomach cancers, and other cancers which are spread throughout the abdominal cavity. And the reason it works is that the heat, which is about 43 degrees Celsius, that itself has a anti-tumorigenic effect. That means it sensitizes the chemotherapy to kill and penetrate the cancer cells to up to 6 millimeters of depth. The other thing is that the heat also decreases the platinum resistance. That means the resistance that the cancer cells have got towards the chemotherapy is negated due to the heat. Also, since the peritoneal blood barrier is still present, the chemotherapy doesn't get absorbed into the bloodstream, therefore minimizing side effects. And lastly, because it's done for about 90 minutes and the inflow, outflow catheters are there to kind of create eddy currents and flow currents. So any loose tissue, any loose cancer cells that might be present in the abdominal cavity after the surgery will be taken out of the abdominal cavity, thus decreasing the chances of tumor deposits and thus the chances of recurrence. So these are some of the reasons that HIPEC works. These kill the cancer cells through direct contact and not through systemic effects. That systemic means the whole body is affected by the therapy that is given. So HIPEC is a very effective therapy for peritoneal carcinomatosis. That means diseases or cancers that spread within the abdominal cavity and not outside the abdominal cavity. And I hope this information has helped you understand why HIPEC is actually effective.